Shaping the future of healthcare delivery is a national conversation. Joining me in the studio is a longtime advocate for healthcare reform and the author of the book, Healing Healthcare, The Case for a Common Sense Universal Health System, Senator John Marty. Welcome.
Glad to be with you.
Your book advocates for universal healthcare in Minnesota, and you've introduced a bill in the Senate. Why universal healthcare?
Well, we've got the best doctors, nurses, hospitals. We've got the best medical care, medical research, medical technology in the world here, and the worst system for accessing it. We don't have better outcomes because a lot of people don't get access to the care they want. Our system is so dysfunctional. I think there's bipartisan agreement that it stinks. And if the politicians don't comment on it, the public tells them to, because it's a terrible system. I think we need a healthcare system to match the healthcare quality that we have in this state. And that simply says, instead of having a convoluted health insurance system where you have to qualify to get healthcare, why don't we have a system where everybody just gets healthcare the way we have with public schools? You don't have to qualify. You don't have to qualify for police and fire services, so why do you have to qualify to be able to go to the doctor? And simply put, when you do it that way, if we design a healthcare system designed to keep people healthy and help them get the care they need when they need it, it's actually cheaper. Instead, we always try, and our society always tries to do it the other way. We try and say, let's make sure people don't get too much health care. And we spend twice as much as anybody else in the world spends on health care, despite our efforts to stop people from getting health care.
So let's say Minnesota goes down this path, and we're the first in the nation to have universal health care. What happens to the private insurance market? Does it disappear in Minnesota?
Yes, it would. Under our proposal, we'd be saying we want health care for all, not health insurance for some. It's a very expensive system. If you figure out, if you make an analogy, if you use the analogy of schools, if we ran our schools the way we run hospitals, it wouldn't make any sense. Every teacher, end of every day, spend half an hour calculating how much time he or she spends with the students, send it to the office, the billing office. The billing office folded in all the overhead, the utilities, and so on. Then they'd send it out to the parents' school insurance plans. And they'd all pay for different things at different rates. Not all the parents would pay the co-pays and everything else. So the school would need a billing office. Now, how does that improve education? Or how does it save money? It would cost a lot more, take teacher time away from teaching, students' time away from learning, all this into going to billing. We need a health system that focuses on getting people health care when they need it. And that's cheaper, it makes more sense, that's why we need it.
So I was looking at a website called balancedpolitics.org on the pros and cons of universal health care. They had 8 pros and 18 cons, so there was a lot more
quite balanced,
against.
But okay.
And so I just want to go through a couple of these with you. Some people say that politicians and government do not handle programs efficiently. So if we put it in the government's hands, they would just make a mess of it.
And that's often the case for the way things are. That's why our system, I wouldn't call this a government-controlled healthcare system. Under our bill, every person gets to choose who they want to go to for the doctor, the dentist, the clinic, everything else. There are no networks. Everybody's included in it. You pick your doctor. That's not government telling you what to do. That's you telling yourself what you want to do. Who makes medical decisions? Patients and their doctors. Under our current system, it's often insurance companies or government who tells them what kind of care you're going to get and what you qualify for and what you don't. Instead, when you have patients and doctors making the decisions, that's a people-centered, a patient-centered healthcare system. And frankly, the worry that they're all going to get all the healthcare they want. You know, when doctors and patients sit down with each other and talk about options, they very seldom pick the most intrusive, expensive options. It's not like, you know, you find out, oh, I got Friday morning open. I think I'll go get me another colonoscopy. They're so much fun.
Another con is that taxes will go up, possibly then making us choose between defense and education over health care.
Our Minnesota health plan would be paid for by premiums, only instead of paying premiums to, say, Blue Cross or paying them to your employer out of your paycheck, you'd be paying them to the Minnesota health plan. And we'd all be paying premiums. Everybody would be. Premiums would be based on ability to pay. So it's affordable to everyone, everybody pays something. But the bottom line is, this healthcare system, if you use the evidence from around the world, if you use economic analysis that's been done in our country, it's cheaper to have a healthcare system than to have this convoluted, bureaucratic, gobbledygook insurance system.
So who is managing then this Minnesota health plan?
The Minnesota health plan would be governed by a board democratically selected by local county commissioners from around the state who are involved in healthcare already. They would elect a state board that would be in charge of running the plan. The board doesn't have all the control over everything, though. Again, as I said, it's patient doctor centered, because there would be 10 legally requiring principles that the board would be bound by. It has to cover everybody, has to cover them for all their medical needs, including dental, including prescription drugs, including vision and hearing, including long-term care, nursing home care. Covers all those things. The patients get a choice of provider. All those things are legally binding requirements on the board. So the board cannot just run amok and do what they want. They have to make sure it's a patient-centered healthcare system.
One more con. Many people argue that competition and the free market breeds efficiency and ingenuity.
You know, if somebody thinks that our healthcare system breeds ingenuity and competition, you try and go to a hospital and find out what your bill is going to be. You don't know. Matter of fact, even if you go in network for a hospital visit, sometimes, the anesthesiologist or somebody was out of network. You can't know what your bills are, even if it's not emergency, even if it's knee replacement and you're planning ahead. There's no competition in the system now. What we want to have is a logical system, the way we fund everything else in our society. I mean, schools and libraries, other public needs that everybody needs. We don't have competition between police departments saying, okay, I live in Roseville, so well, you know, I think I'm going to use the Roseville police for this burglary, but I'm going to use some other police department for something else. You want to deliver services efficiently and negotiating fair prices with providers. The competition is at the provider level. I want to be your doctor, so I'm going to do a better job than somebody else. That's where the competition needs to be.
Before we go, I'd like you to weigh in on Governor Dayton's proposal this week for the public option to Minnesota Care. Is this a step in the right direction? Is this a compromise that you're willing to go towards?
It's not a step in the right direction. It's a good thing to do. I definitely would support it, assuming it's worked out in a way that's going to be functional and workable. But right now we got so many people who are desperate with these high premiums, everything else. This will give them temporarily an option that they can get into at an affordable rate. I don't see it as a solution. It doesn't fix the bureaucratic gobbledygook system we have. It's so convoluted. People are sick of it, and they don't know what to do. We have so many Minnesotans who can't afford to go to the dentist. They can't afford $10,000 deductibles. They can't afford all these other things. That his Minnesota Care buy-in is a good thing to do. I support it. I think it may help people, but it doesn't solve the problem. We need to have a logical system, and that's what I'm going to keep pushing for.
Senator Marty, I want to thank you so much for coming today.
Thank you very much. Glad to be with you.